Okay, welcome back. All right, so we're here today with Jackson. He's a massage therapist and also trained in dry needling. So what we've been doing is a series of videos on my elbow here, my tennis elbow, lateral epicondylitis. And so we've done a few different things, but I wanted to try needling. Do you think that could help?
Yeah, absolutely. For sure. Yeah.
Okay, let's get to it. We can probably talk while we do it.
Yeah, no worries.
Am I all right here like this?
Yeah, absolutely.
So I'm not back on you, or?
Yeah, that's fine. Just get nice and
I
comfortable.
imagine you're going to do this area.
That's correct. Yeah. So just
Okay.
get nice and comfy.
Okay. All right. Is it going to hurt?
No, it shouldn't hurt. We can make it nice and gentle for you.
Trust you.
Yeah.
Small needles.
Yeah, just small, really fine needles.
Okay.
Really don't feel them go in, but this is really helpful. We find a lot of people do get a lot of relief, even from just, as you'll see, sort of 1 or 2 minutes.
Oh, really? Okay.
Yeah. So there's a number of ways that we can do it. I guess the basic principle of it is we go in, leave the needles in for a little bit, and it does its thing, comes out, and you get a lot of pain. Hopefully, get a lot of pain relief.
Right. Okay.
Cool.
Right.
All right. So
you're working on the muscles and around the bony origin
correct.
of the muscle?
Yeah, correct. So this is sort of where you
Yeah.
find that the injury is
Yep.
to this lateral epicondyle.
Yep.
So we're going to work through the muscles. It works the best if we do put it through the muscles there.
Okay,
Right?
sure. Okay.
So what I'm going to do, I tend to like to palpate through the muscles
Right.
and find any areas of restriction or tightness.
Yeah, that's tender there.
Yeah, tender there, and we tend to find probably tender there as well.
A little bit there.
Yeah.
That
So
one in there, yep.
this one here, and there's a lot of different muscles that run through here, this extensive compartment.
Sure.
So we're just gonna
Whack a few in there.
whack a few and
Okay.
and how's that there? Is that sort of
Not terrible,
not
pain, a little
terrible?
bit tender.
Yeah.
It has got better.
Yep.
As I said, we've done some massage, done some active release, ice pack, cold packs, laser over the last few weeks. Every week we're trying a new therapy.
Yeah.
So it has improved. I think the active release was one of the best things we did.
Yeah. So one of the main ones that I like to do is just go straight into this muscle
Alright,
here.
okay. Ouch.
Feel a little bit of something there.
Yeah.
Yeah.
Oh, yeah. Ouch. Okay.
You alright?
Yeah, I said put it on an angle, you're going along the belly of the muscle.
Correct. Yeah.
Okay.
Yeah.
No, it stings. It's okay.
A little bit of a sting.
Right, so you call this dry needling.
Yep.
Tough question. What's the difference between dry needling and acupuncture?
The needle types are the exact same.
Right. Yeah, so it looks the same, doesn't it?
It looks exactly the same. It's just the mechanisms and principles behind it. Probably we don't have enough time to get into it straight away.
That's right, so that's a
Yeah.
tough question. So acupuncture is more traditional Chinese medicine,
Correct.
however many thousands of years old, and it's been adapted more for modern technology. Modern usage. Technology hasn't really changed.
So how's that there?
Oh, look, it's just a little pressure.
Little pressure,
All
yep.
of that. Oh, I'm in my fingers in it. Rules.
Yep.
That's weird, isn't it?
Yeah. So what we can
Okay.
do, there's a number of ways that we can do it. We can leave them in like that.
That's it, just leave it.
They're
Wait
pretty much,
minutes.
they have done what they need to, so we can pull them out straight away and we dispose of them properly.
Right.
But we can do a little bit of stimulation as well.
Okay. So we're going to ramp it up a bit.
Yeah. So what we can do, we can
Ooh, I think it's better if you don't look.
piston in and
Yeah,
out.
it doesn't really hurt, just feels weird. Yeah, okay.
But with these ones, yeah.
Oh, I see, so you pull it in and out, and that's just more stimulation.
Correct, yeah. So,
So I think we're trying to stimulate the area to create healing,
yeah.
block pain. Okay.
There's going to be potentially a lot of inflammation, so there can be a little bit of sensitivity there as well.
Yeah, sure.
We're just trying
Okay.
to
So when it's inflamed, it's a epicondylitis, which the itis means inflammation. So it's hot and it's flame, that's when we put the ice on. Okay, so it was a little bit of a twinge there.
Yeah.
Okay. So the more you stimulate it, this is the advanced technique. It's supposed to be dry needling, not blood.
That's what
We
we're
struck
at.
blood, so occasionally you hit a little artery.
Yeah, you can hit a
little artery or vein.
little artery vein. That was very superficial as well.
Just a dot of blood. Okay, so that happens occasionally.
Happens from time
Nothing
to
to worry
time.
about?
Yeah, that's why we're
You're not worried?
not worried, no.
Okay, it's not you. Okay, good, brilliant. Oh yeah, I think it's better if you don't look, personally. Yeah, okay, so as you're going in and out, and you can twirl the needles as well.
You
were
can
telling
twirl a
me.
little bit, yeah, just wind up the fascia a little bit.
So the fascia is what we're releasing with the massage
Yeah,
earlier on.
Yeah,
But twirling, it's going to grip the fascia and break some of the adhesions in there.
correct.
Yes,
Yeah,
so-
yeah. As well, no blood.
Okay, alright, so that's pretty quick. But you can leave them in there longer?
You can,
Sometimes
yeah.
10, 15 minutes?
Yeah, absolutely. 10-15 minutes. That's if we were to get around the epicondyle itself.
Yeah, right.
Yeah, we would.
So if I got this problem, how often should I do this? Like once a week, or 2 or 3 times a week, or?
With the needling, just really maybe 2 or 3 times a week. If it's something that's quite sensitive and you don't want needles a couple times a week, which is perfectly fine.
Yeah.
You can do it once a week and.
But do it a few
just-
weeks
yeah.
in a row?
Yeah.
Yeah.
The more the better. If we can get onto it
Right.
early.
Okay,
Yeah.
so a few in a row, give it a course of treatment.
Yep.
And then hopefully see some improvement.
Correct. Yeah.
Okay.
That's
that
it.
it?
That's
That's
it.
great.
Yeah.
Okay. Okay, well, I was feeling a little bit better anyway. Certainly stirs it up.
It
Certainly
does,
a real
yeah.
pinch, but it's quite simple, straightforward. It's all very clean. You dispose of the needles,
Yeah.
and a little bit of pain, but I think it's really worth it. It'd be difficult to do this on a really acute, inflamed.
Yeah, probably wouldn't
case.
do it too acute, but as it gets more chronic, yeah, that's when we can use the dry needles.
Yeah, exactly. That's why a few weeks ago it was really sensitive. It's starting to improve now, so it's a good time to get the needles in there and
Yeah.
help stimulate the healing. Right, thanks, Jackson. Thanks for your help.
No worries.
Cheers.
All good.